Welcome back to the Morning Blend. WellHealth Medical Week continues with the role of midwives. These highly educated and specially trained professionals play an important role during a pregnancy and after. Here with more is certified nurse midwives Charlene Hanna-Manfull and DeTie. Good morning to both of you. Welcome.
Good morning. Thank you.
Angela, let's start with you. We've all heard the word midwife. What exactly is a midwife and what do they do?
Okay. The easiest way to start off with is to clarify for this discussion that we're talking about certified nurse midwives. So that being said, we provide support, education, guidance throughout the lifespan of a woman and helping them to make the best informed decision for their health care, whether that be for their birth or for their GYN care. For obstetrical purposes, we really help them to get to their goal, what they want to do for their pregnancy, and that's different for everybody. We also, although we do the same screening medically, we do a lot more for support during the labor process because we can offer non-medical interventions to help them cope with the discomfort of childbirth.
You're very hands-on. You're there every step of the way for the woman.
Absolutely.
For the new mom.
Absolutely. So when we're there at the hospital, we tend to be there a little bit longer than obstetricians, especially we like to say that golden hour afterwards, so that to help them do their bonding process and get the breastfeeding started, so the whole family gets to join in that. So.
And Charlene, let's talk about the education. What does a midwife typically go through when they're training for this career?
Sure. As certified nurse midwives, we are nurses first, so we're all registered nurses. We have all gone through an advanced training program for nurse midwifery as well as women's health care. The majority of us do have master's degrees in nursing from accredited universities. We have all passed a national certification exam in order to have the title of certified nurse midwife as well. We have continuing education every single year in order to really know the most prominent evidence-based research to be able to care for our patients the best.
And so you're with the woman every step of the way, you're helping them out, and do they ask questions that maybe sometimes they can't get to a doctor and they'll ask you for help and guidance?
Absolutely. When they come in, many people don't know what they should be even asking. It's like, what do you want for your birth process? Well, I don't know. What should I have? And so it's a way to get them to what they want. And so they come in, and every time you bring your list of questions to ask, because by the time they get to the car, they've already forgotten, oh, I should have asked that question.
That's a great tip.
And so we learn and teach along the way for the pregnancy process so that they can get to the end and they know everything already.
And when they sign up for someone to get help like through you guys, do they start from the very beginning or do they typically learn about it later and then they sign up with you guys?
Well, we have some that began their prenatal care with us because many of them are already our gynecological patients. We do their pap smears and their annual exams and their family planning, and so then they just merge into the pregnancy process. We do also get late transfers or transfers mid-pregnancy when they decide that the perfect analogy is to have that partnership with your provider so that there's a comfortable relationship, and that's what we are, a partnership with these women. So
yeah, it's very tight time that you're bonding with these ladies.
Absolutely.
They trust you. They rely on you for help, and so you're there for every step of the way for them. Let's talk about some of the other services that you might provide as well.
Okay, we do, as I mentioned, we do annual exams, we do family planning, we do comprehensive gynecological care. We'd be doing everything that you would see an OBGYN for, with the exception of surgery and high-risk problems.
And how is WellHealth Women's Specialty Care different from other centers?
Most definitely. I believe that the midwives at Women's Specialty Care, we really have a unique relationship with our patients. We really strive to have a very honest and trusting relationship. We get to know our patients. We know what their expectations are in regards to their pregnancy care and their goals in their lifetime, really what their ultimate plan is for labor and birth. And we try to do the utmost that we can to make that happen for them, and so that everyone is happy and we have a really great experience.
And you talked about educating women also every step of the way. What's the #1 question you get from women going through a pregnancy?
Is it going to hurt?
Does it hurt?
Yeah. We like to use the word discomfort rather than pain, but you know, it's one of those things where it's not the pain of a toothache. You know, it's a little different, so we have a natural process going. So I think it helps in the analogy of it. So,
are there misconceptions, do you think, that people hear about that you want to clarify?
Most definitely.
Where should we start?
Yes, exactly.
I think one of the bigger ones is that we're not educated.
Right.
So when you look at the realm of what midwives are and how many different types there are, as Charlene explained, it's kind of a rigorous process
Training
of many
program.
years of training.
Exactly.
Absolutely.
Well, ladies, thank you so much. Some great information for us this morning. Thank you.
Okay, great,
You're welcome.
thanks.
Thank you.
Charlene and Angela are with WellHealth Women's Specialty Care. They have 9 locations and more than 45 providers in Nevada. You can contact them at the phone number or website on your screen. They offer a comprehensive list of services and procedures, all focused on women and women's health. The group is also on Facebook and Twitter.